All right, hello, my name is Cindy and we're going to be doing an exam on my patient here today. We are going to be doing a GI, musculoskeletal, and neurological exam today. My patient here is starting off with a general survey. She is awake, she is alert, she follows commands appropriately, she is well groomed, and skin is appropriate for her ethnicity. So we're going to start off with her GI assessment first. Okay, so exposing her abdomen. All right, we're gonna inspect first. So looking at her abdomen, I don't visually see any postations or peristalsis. She does have a scar here noted from a previous surgery. Her stomach is protrudent. Otherwise, skin is intact. We're going to listen for bowel sounds on all 4 quadrants. Okay, so bowel sounds are normal, active, and present in all 4 quadrants, which is a normal finding. Moving on, I'm going to auscultate her abdominal arteries for any bruits. So we're going to start off with her aorta, her renal, iliac, and femoral. Okay, and no bruits noted, which is a normal finding. Okay, we're gonna move on to percussion next. All right, so we're gonna percuss all 4 quadrants. Okay, so tympani is present through all quadrants except the right upper quadrant where the liver is located, which is an expected normal finding. Moving on, and it's also tympanic over the spleen, which is a normal finding because you don't want that to be palpable. Once we move on to the palpation, I'm going to start off with a light palpation, noticing if my patient is in any pain or grimacing. She is not, so that is normal and expected. Next, we're going to do a deeper palpation. So I'm going to go in a little deeper. We're palpating. Again, no pain noted. I do feel the liver border, and it doesn't move past the coastal margin. The spleen is non-palpable, which is a normal finding. And again, no pain or tenderness noted. So liver, spleen, we're going to palpate the kidneys as well. And the kidneys are non-palpable. Okay, all which are expected findings. So that completes our GI exam. Next, we're going to move on to the musculoskeletal. Can you sit up for me and help my patient to the sitting position? All right, so we're going to start off with the upper musculoskeletal exam. So I'm going to start by inspecting. So I'm looking at her clavicles, her spatula, and her shoulders. No deformities noted on inspection. Now I'm just gonna palpate. Okay, back here, both shoulders, no pain or tenderness reported, which is a normal finding. Okay, moving on, we're going to do the range of motion and strength of her neck. So looking, I'm gonna ask my patient to move her neck ear to ear. Perfect, up and down, perfect, and then side to side. Perfect, so full range of motion. Now I'm gonna test the strength. Move your hand against resistance. Okay, this side, okay. Now turn, yep, turn, okay, and 5 out of 5 strength for her neck there. Moving on, we're gonna do the shoulders. So range of motion for the shoulders, arms up above your head, all the way up, perfect, then come down and cross, perfect, now behind, perfect, and then come out and up, straight up, Perfect. So full range of motion of her shoulders. You can relax now. Then I'm gonna test the strength of her shoulders. Next, can you pull your shoulders up, shrug, and this 5 out of 5 strength there. Perfect. So moving on, I'm going to do her elbows. So looking at her elbows, inspecting, I don't see any abnormalities. I'm going to palpate her elbows. I don't feel any deformities. Patient is not reporting any pain or tenderness. So moving on to the range of motion, I'm gonna ask her to, like a dumbbell, yep, perfect. And then can you move like this, in and out, perfect. Okay, full range of motion. Now I'm going to test the strength against resistance, push against resistance, this way, yep, other way, perfect. Okay, so 5 out of 5 strength there as well. Okay, so we're gonna move on to her hands and wrists. So again, inspecting her hands and wrists, I don't see any nodules or any deformities. I'm gonna palpate her fingers and her wrists, no pain or tenderness reported. Moving on to the range of motion of her wrists, I'm gonna ask her to up, down, side, other side, perfect. Can you wiggle your fingers? Perfect. So full range of motion there. I'm gonna ask her to squeeze my hands. Perfect, 5 out of 5 strength there. And then I'm gonna ask her to push your wrist up. Yep, and down. No, like push your wrist down. Perfect. Okay, so 5 out of 5 strength there as well. All normal inspected findings. I'm gonna move on to the reflexes. Okay. So we're gonna do bicep first, relax. Okay. Bicep first. Okay, +2, normal finding. Okay, relax. Okay, +2, normal finding. Then the brachial apparatus. Okay, +2, normal finding. Other side. Okay, +2, normal finding. Next, we're gonna do the tricep. So I'm gonna hang her arm, relax. Find the elbow. Okay, +2, normal finding. Now moving on to this side. I'm gonna hang her arm, relax. Okay. And again, +2, normal finding. So those are all expected reflexes. Okay, so now we are gonna move on. We're gonna do her hips. So let's move on to her hips. Can you lay down for me? Lay down. For acá there. Okay, so we're gonna inspect one side first. I don't visually see any abnormalities again. I'm going to palpate. Let me get on this side. Okay, so we're palpating. No pain or tenderness noted. Okay, can you turn to the other side for me, please? Okay, perfect. And again, we're just gonna palpate all the way back here. And no pain or tenderness noted. Okay, all expected findings. I'm gonna ask my patient to stand up for me, and I'll give her a hand, and we're gonna do some range of motion. Okay, so I'm going to, let's actually turn this way. So we have this way, yeah. Okay, so I'm gonna ask you to put your leg up like this. Perfect, other side, perfect. Kick towards me, perfect. Other leg kick, perfect. Back, perfect. Back, perfect. Okay, so full range of motion. And then can you turn like this and turn like that? Perfect, full range of motion in her hips. Next, we're gonna do the lower extremities. I'm gonna grab her a chair so we can do that. Wait. Okay, have a seat. Make sure we're on camera. Okay, perfect. All right, so we're gonna do the lower extremities. So we're gonna start off with her knees. So looking at her knees, they're intact, no visual abnormalities noted. I'm going to palpate. Okay, no pain or tenderness. Looking at my patient to see if she's grimacing. She doesn't report any pain or tenderness, so that's an expected finding. Moving on, we're going to do range of motion. Can you kick? Both of them? Yep. And then in, all the way back. Okay, perfect. So full range of motion, we're going to do the strength against resistance. Push. Okay, other way. Push. Okay, perfect. So it's 5 out of 5 strength. Next, I'm going to do her reflex. Okay. Okay, that was a +2. And that was also a +2. So expected findings there as well. All right, so we're going to move down to her feet. See if they're on. Yeah. Okay, moving on to her feet. Okay, so ankles and feet upon inspection, no abnormalities noted. I'm going to palpate. Any pain or tenderness noted? No. Palpate. Pain or tenderness noted? No. Okay, perfect. So range of motion of her ankles. Can you put your feet up, down, in, out? Perfect. Can you push down like a gas pedal? Perfect. Push up. Perfect. So full range of motion there as well, which is all expected findings. Okay, so moving on, we are going to do the reflexes of her Achilles. Okay. Perfect. +2. Perfect. +2. Okay. And next, her plantar. Okay. She curled her toes in. Perfect. And she curled her toes in. So those are all expected normal findings. All right. Perfect. All right. So now that completes our musculoskeletal exam. We are going to move on to, no, I'm sorry, we still need to do the spine. Can you stand up for me? This will be our last musculoskeletal. Face the camera. Okay, so looking at her spine, we're going to inspect. I don't visually see any abnormalities. I'm going to palpate her spine. All right, no curvature of the spine noted, no pain or tenderness reported. So we're gonna do some range of motion of her spine. Okay, I'm gonna hold my patient. Can you bend down and touch your toes? Touch your toes.
Oh.
Okay, perfect. Okay, now back. Move all the way back. Perfect. Okay, so she was able to do that. Next, can you move to the side? Okay, side, perfect. So full range of motion of her spine, which is a normal finding. I think we did the rotate. Did you rotate? Yeah, I think we rotated, perfect. Full range of motion. Okay, so that completes our musculoskeletal exam. I'm gonna have my patient sit again, and now we're gonna move on to the neurological exam. So where's my cotton? We're gonna start with the light touch, so the intersective sensation exam. Can you close your eyes and let me know yes if you feel me touching you?
Yes. 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 Yes.
Okay, so that is a normal finding, expected finding. She was able to identify me touching her. Moving on, we are going to do the sharp and dull. Okay, so sharp and dull. So close your eyes and let me know.
Sharp.
Okay, good.
Dull.
Dull, good.
Dull.
Again.
Dull.
Again. No.
Sharp.
Good.
Dull.
Okay, good. All right, so she was able to identify that successfully. So those are normal findings. Next, we're gonna do the temperature exam. So I'm gonna ask her to close your eyes again, and then tell me what you feel. Cold or hot? Good. And then what is this? Cold or hot?
Hot.
Okay, perfect. So she was able to properly identify those two temperature items, which is a normal finding. Okay, so moving on, we're going to do the proposition exam. So I'm gonna ask her to close her eyes, and let me know if your finger is up or down, okay? So up or down?
Down.
Good.
Up.
Good.
Up.
Good.
Down.
Perfect. So that was a normal expected finding. She was able to successfully identify which motion her fingers are going. So keeping her eyes closed, I'm going to place vibration on her bony prominences, and you let me know when you feel the vibration and when it stops, okay?
Okay.
So can you feel that?
Stop.
No,
No,
can
start.
Okay. And let me know when it stops.
Stop.
Okay, good. Again. Can you
Yes.
feel that?
Yes.
And let me know when it stops.
Stop.
Okay, perfect. So she was able to, that was the vibratory exam, she was able to successfully identify those correctly. So moving on, we're gonna do the cortical sensation. I'm going to grab 2 items here with her eyes still closed. So close your eyes, let me know what's in your hand.
This keys.
Keys, perfect. So that is correct. And then I have this.
This is coin.
A coin, perfect. So she was able to successfully identify those 2 items. Moving on, we're gonna do the graphesthesia exam. So I'm going to write something in her hand, and she's gonna let me know what it is. What is that?
C.
Yes, correct. And then what is this?
E.
Correct. Okay, so she was able to correctly identify those things. So graphesthesia exam is correct. Next, we're going to do the 2-point exam. So 1 or 2, okay?
Okay.
All right, so
1.
okay,
1.
okay,
2.
okay,
2.
okay, perfect. So she was able to correctly identify the 1 or 2, so that is a correct finding. Next, we're going to do extension. So I'm gonna touch her with eyes closed, and let me know if it's right, left arm, or right, left leg where I'm touching, okay? So where am I touching?
Left arm.
Okay.
Left. Right, left.
Right leg, okay, perfect. And then what is this?
Right arm.
Right arm, and then
Left
leg.
leg.
Okay, perfect. So she was able to successfully identify where I'm touching her, which are all normal expected findings. So moving on in the neurological exam, we're going to do coordination and sensory. So we're going to do the rapid movement. So with your hands, can you go like this? Perfect. So she was able to do that coordinatedly, which is a normal expected finding. Good, perfect. Next, we're going to do the heel to shin. So one heel straight down, perfect, and then the other one, perfect, good. So she was able to do that accordingly as well. Moving on, we are going to do, okay, we did that. We're gonna do the balance test next, the balance and gait. So I'm gonna have her stand up and stand. All right, and I'm gonna have you walk. See if she's in frame. Okay, so walk. Okay, now back, walk back. Okay, now walk on your heels.
Okay.
Perfect. Walk back. Okay, good. Now tippy toes. Okay, good. Back, move back. Okay, now do heel, toe, heel, perfect, toe, heel, toe, perfect, and now you can move back, excuse me. Okay, next we're gonna do the Romberg test. Move it over here, okay. Close your eyes, and I'm looking for any swaying, if she can keep her balance, but she is, so that will be a negative Romberg test, okay? Open your eyes, and next we're gonna see if there's any drift. Okay, arms up. And seeing if there's any drift. No drift notice. So that is another normal expected finding. And that concludes my assessment. Thank you for watching.